I can't take much more of this.
Yeah.
Oh.
Hi, Miss Jones. How are you?
Hi, how are you doing?
I'm good. You, Mrs. Jones? How are you feeling today?
Oh, well, you know how it is. I can't take much more of this.
Well, I did get your letters that you have sent, and I just want to see, I'm very sorry about your prognosis, but do you understand your decisions that you're making, you and your daughter both?
Well, yes. My mom had the same cancer that I did, and I saw her suffer so horribly. She was attached to tubes. She barely knew what was going on when she died. It was awful. I don't want to suffer that same fate. It was so traumatic for me. I just want to go peacefully in the comfort of my own home, surrounded by my family.
I understand, but do you understand the options that you do have besides this one? Have you looked into pain management, palliative care, or hospice of any of that kind?
You should think about it. I need you.
The doctor says I only have 4 months left to live. I know that's only an approximation, but I know I don't have much longer. I just think I can't take the pain anymore. It's too terrible. I don't believe in palliative care. I want to die on my own terms before it gets worse. I want to be able to say goodbye.
Okay. Well, I'm glad that you understand your other options, but by law, I can only prescribe you your medications, which you would then have to go on your own time and fill it, and then take the prescriptions as whenever you decide. Now, are you willing to go into counseling to help make your decisions, or
I'm
is
not
it just
depressed.
final?
I'm not depressed. I've thought about this for a long time, and I know what I want to do.
Okay.
Mom,
I'm serious about
what
this.
about us?
You'll be okay. Trust me, it's better this way. I don't want you to see what I had to see. It was terrible.
I can
It's
see
awful.
that you're very serious and determined about your decisions. So I'm going to go ahead and call another doctor to get a second opinion on your case. And we'll see if he thinks that you are capable of making your own decisions right now for this situation. And right now I'm going to have you sign some medical papers to make sure that you understand your decisions and that you've been given other options about your choices. And just read this, go ahead and read it with your daughter and make sure you understand it completely, okay? And you can opt out of this decision anytime you want to. It's not binding in any way.
Request for medication to end my life in a humane and dignified manner. I, Mrs. Jones, am an adult of sound mind. I am suffering from pancreatic cancer, which my attending physician has determined is a terminal disease, and which has been medically confirmed by a consulting physician. I have been fully informed of my diagnosis, prognosis, the nature of medication to be prescribed, and potential associated risks. The expected result and the feasible alternatives, including comfort care, hospice care, and pain control. I request my attending physician prescribe medication that will end my life in a humane and dignified manner. Can I borrow a pen, doctor?
Yes. And you both understand the conditions of this agreement?
Yeah.
I have informed my family of my decision and taken their opinions into consideration. I understand that I have the right to rescind this request at any time. I understand the full import of this request, and I expect to die when I take the medication to be prescribed. I further understand that although most deaths occur within 3 hours, my death may take longer, and my physician has counseled me about this possibility. What do they mean by that, Doc? My death could occur longer than 3 hours?
Depending on how much of the medication you have taken at that one time, your death can be quickly or slowly, depending on the medication. Should not be painful at all. The medication is supposed to be able to sedate her enough so that she will just go peacefully.
Okay. I make this request voluntarily and without reservation, and I accept full moral responsibility for my actions.
And have your daughter sign as a witness?
I don't know if I can do this.
Trust me, it's better this way. You'll be okay. You have to support me on this. I know what I'm doing. Thank you, Doctor. You don't know how much this means to me.
Thank you. And I will make the the appointment with the other doctor, and I'm very sorry about your prognosis.
Thank you, doctor. Thank
Video.
you. Oh, thank you.
Hi, I'm Julia Johns. My mom, she decided to, I couldn't even say it. This is so hard for me. My mom, she decided to take some pills. I don't even understand what's going on. It just, and pass and die because she just cannot take it anymore. I'm trying to talk to her, but she says she's going through a lot of pain. So I guess as a daughter, I have to support her. I don't know what we're gonna say to my kids. I don't even know what we're gonna do. So I've been trying to talk to her, but she just don't want to listen. And well, I'm just gonna here to support her, and I hope that she's making the right decision. So I'm sorry, I cannot talk anymore.
I never thought I'd die with cancer. I always thought I'd die with old age. But I'm certainly not going to die hooked up to tubes, being completely controlled by machines and ventilators and all that. I want people to remember me as how I lived, full of life, independent. It's not the pain that scares me. It's the loss of being able to get out of bed in the morning. You know, being able to cook my family a nice dinner. I can't do anything anymore. And I just want to die knowing that people saw me as how I was, not what I'm gonna be. A hollow shell, riddled with cancer if I keep going the way I'm going. I want to die with dignity.
I'm Dr. Johnson, and I have been working with Mrs. Jones' case for quite a while now. Very sad case, one of the many sad cases I've seen. Many cases like this before with her and her daughter. It's very sad to see that. She was diagnosed with pancreatic cancer, and she had less than 6 months to live. With the decisions that she had made, it's not a simple process. It takes a while. There are legal complications that you have to think about. One of the things that she did was sign a consent form. The consent form had to have her and a witness, which was her daughter that we had in the room. She had to have 2 oral requests and 1 written one. With the oral requests, within the first time she orally requested it, it had to be a 15-day wait period. With the 2 written requests, it had to be about 48 hours before she can come in and see the doctor. So she has to wait 48 hours before she can get the medication to take. This decision is not binding. Mrs. Jones can change her mind and decide not to take the medication if she decides not to. And another problem that we have to address is that she needs to be mentally capable of making that decision. So she would have to be looked at by me, and not only me, but another doctor who can confirm that she is able to make that decision herself. The second doctor also has to confirm all the information of the patient is conceded, what's the word? Second doctor has to verify all the information too, like the patient has 6 months to live, and all the consent forms are signed, and the patients understand her options that are available besides the one that she's choosing.